for a vote. Meanwhile, Republicans rolling out its own plan, 230 pages in length, 1/10 the size of the Democratic plan on the table in the House. Democrats ridiculed that plan, producing a binder full of blank pages, pretending it's the Republican idea. All this as Republican members make bold plans to block a vote on the Pelosi bill later this week. And Congressman Pete Hoekstra, Republican out of Michigan, talked about that. Good morning, sir. Democrats contend your ideas are just a big blank slate. What do you say to that?
Well, I think if you go back the whole year, you can see that Republicans have been putting forward ideas all throughout the year. And what we've done is we're doing exactly what the American people have asked, is break the health care bill into segments, fix the law so that people can't be excluded from coverage because of pre-existing conditions, open up competition, open up markets, and provide tax incentives to enable all people to go out and buy health insurance. The difference between our plan is we rely and we trust in the American people. We only need 230 pages to protect American freedoms. They need 2,000 pages to take that freedom from the American people and move it to the government.
But you know Democrats run the show. What's the chance that any of what you're describing right now is included?
Oh, I think it's not included, because what you've got in the new bill, the Pelosi health care bill, is a massive transfer of freedom from the American people and an assumption of power by the federal government. So those things that would allow markets to work, that would allow people to control the relationship between them and their doctors, that's all gone, and that's going to move to into the Washington bureaucracy through the Pelosi health care bill.
Well, I think what America is trying to figure out is whether or not this is going to get done. Then if it gets done, they're going to try and figure out how it affects them. Now, I know the House is getting ready for a vote on Friday or Saturday of this week. But what I think is going on the Senate side is very intriguing. Harry Reid is now pushing the calendar back to after the first of the year. I mean, if this spills into the spring of next year, does it ever get done, do you believe?
Well, it potentially can get done, but as a very sharp contrast, Harry Reid is now saying the Senate is going to be moving into January. Here, Nancy Pelosi is trying to move this bill through and try to get it done this weekend. We're scheduled to be home for Veterans Week. Why doesn't she postpone the vote for another week or so that Democrats can take her bill and explain it to their constituents? Republicans can take our ideas, explain it to our constituents, and we can have a real debate at the grassroots level about the two very different approaches on health care rather than trying to ramrod it through. Speaker Pelosi wants the vote now because she knows that if her members go home, they will get an earful from their constituents and they will not be in favor of this bill. She needs them to vote before they go home.
As you watch the calendar, it may happen before the weekend's out, a House vote on the floor. Quickly, in the 15 seconds I have left here, what are you trying to do tomorrow? How are you
what we're trying to do is we're trying to give the American people a voice and make them connect with those 50 or 60 members in the House who are still sitting on the fence. Come to Washington, express your views, and get your voice heard here in Washington.
Thank you, sir. Pete Hoekstra, Republican from Michigan. We're going to speak with the Democrat in about 30 minutes from now on the health care agenda and what's happening in the